Meanwhile, one thing no one's talking about is the 21% cut in Medicare fees to doctors that was enacted just yesterday. Now, congressional Democrats in the White House are urging Congress to patch that leak pronto. At the same time, the big health care bill calls for $500 billion in cuts to Medicare. So is this the first example for how Congress has a chance to cut Medicare, and yet they're already balking? Dr. Manny is a member of our Fox Medical A team, and Dr. Cathleen London is a family practice physician. And doctors, thank you both of you for coming in today. There's a political component to this, but also there's a practical component, and that deals with you and what you do is for a living and how it affects us, the patient. If I were your patient, Dr. Manny or Dr. London, how will your practice change, Manny, if these cuts come your way and they stay permanent or they go deeper?
You know, what would happen probably is a reduction of new Medicare patients because, look, in order to kind of break even nowadays, you have to see an average of 40 patients. You know, many practices in primary care, gynecology, cardiology, you're seeing 40, 30 patients daily just to break even. The operational cost of a practice has gone up dramatically. Medicare payments have not gone up to compensate for that. So if you cut this down to 21% more, basically, in some cases, you're going to get reimbursement, which is less than Medicaid, and many doctors are going to say, you know, we're not going to practice medicine anymore.
You're working for less money. Dr. London, if I'm your patient, how does that change our relationship?
So you have to remember that most physicians are small business owners, and who out there can afford a 21% pay cut? The problem is it doesn't just get extended to Medicare, is that private insurers follow what Medicare does. So what does this mean? It means we stop taking Medicare and Medicaid, and ultimately we either close doors altogether or stop taking insurance. So that's what it means, and we already have a shortage in primary care. And this is just going to extend further. So plus, all of us who have employees are going to lose employees.
I have to go find another doctor. I have to wait in a longer line, or I continue to see you and I pay you cash. Is that what I'm hearing from both of you?
Well, look, it's never going to get to the point that you're going to pay cash because, you know, many people don't have the cash. And, you look, the ethics of medicine will never allow Americans not to have access to health care through the doctors, by the way. The doctors are going to carry this torch. But it is unfair that, you know, everything, you know, for instance, this bill has put together unemployment with medical payments. You know, why do you need to put them together? You know, they're sort of mixing things in an effort to scare the public. I'm very much in favor of not having more deficits for sure, because I'm interested in the future of my children. But on the other hand, I have to pay for their livelihood now. So it's you know, they're always using doctors as pawns, and basically they're holding a gun to my head and just, you know, taking me along for a ride for a very long time.
You're referencing the objections that Jim Bunning has to the bill that we've been talking about. It gets a little confusing at home, but they've been folded into one another, the unemployment benefits and the Medicare cuts. Dr. London, do you think Congress will ever make $500 billion worth in cuts to Medicare?
Okay, so let's separate this all out. These cuts to physicians go back to the 90s when they were trying to correct a budget deficit. So where did they go? Let's cut payment to doctors. And then it keeps getting held off, and each time it comes back, it's at a higher percentage. So this is a sign that we cannot afford to do nothing about health insurance reform. And notice I said health insurance reform, not health care reform. People are already paying. We already cover everybody. We do it in an expensive way, though, through the emergency room and through other methods.
Many would argue that Congress is not going to go forward with the cuts because they never have in the past. This is an excellent debate. It will be continued. In fact, we'll continue it tomorrow when we get more details from the president. Doctors, thanks to both of you.
Thank you.
Kathleen London, Manny here in New York and Boston, respectively. Martha, what's coming up?
Well,